A year ago, I asked about the $6.55 billion gap in health spending between metropolitan and regional Australians. The response was that the gap was being addressed. Now the National Rural Health Alliance reports that the gap has increased to $8.35 billion, over $1,090 less in annual spending on the health of each regional Australian. Minister, it's getting worse a year later. What urgent steps will you take to fix this inequality?
You call to the Minister for Health and Aged Care, the Minister for Disability and the National Disability Insurance Scheme.
Thank you, Speaker, and thank you to the member, fellow South Australian, for that question and her ongoing interest in health equity, particularly considered in geographical terms. As I've said to the member a number of times, we're doing all that we can to ensure that Australians living further away from our GPOs are getting good, equitable access to affordable care, particularly primary care. So if you look at the results of our first investment in bulk billing, I haven't checked for a little while, but the member knows, I think, that the biggest increase in bulk billing rates of any electorate in this entire parliament have been in the member for Mayo's electorate, or maybe the member for Clark's electorate. You're 1 and 2. I can't remember who is number 1, who is number 2, and that is because the bulk billing incentives paid to GPs outside of the major cities are higher than the changes we've made to doctors who are working in our major metropolitan areas. And that goes the same for the bulk billing investments that will take place on the 1st of November. The increases for a GP bulk billing in rural and regional Australia are very significant outside the major cities. They're significant in our cities, but they're more significant outside our major cities. We're also doing all that we can to encourage doctors, nurse practitioners and other health professionals to move outside of the cities and practice there. We've had a range of incentives in place to encourage doctors to do that and nurse practitioners. The Minister for Education passed legislation that is now in force that means that recent medical and nurse practitioner graduates who go and work in the country get substantial student debt relief related directly to the level of remoteness in the area that they're working in. Look, we know that there is more to do. The National Rural Health Alliance is a terrific organisation I meet with. I know members right across the parliament meet with very regularly. The tyranny of distance has been one that has bedevilled our healthcare system for the entire history of our nation. Technology does help that. That's providing some relief to Australians living outside our major cities, but we're also doing all that we can to support particularly general practice, make sure that they can really run a thriving, viable business. Just to give you a sense of what the impact of our bulk billing incentives will be for a GP. A full-time GP bulk billing every single patient that comes through their door in the major cities from the 1st of November will earn about $400,000 a year if they're working in our major cities. In an average rural community, that rises to about $457,000 a year, a substantial increase, and that uses the earnings calculator that is used by the College of GPs and the supervisors. I see some GPs frowning behind you, member for Mayo. That is using the earnings calculator used by the sector itself.